Good morning. My name is Justin Weiner, and I'm chairman of the board of Charlotte, a 105-year-old family manufacturing business, and it is my pleasure to be the first to be able to introduce Governor Baker and his team to our new operation here. I can only say before I pass it on to James Weiner, our CEO, that at 95 years of age, and this being my only job, I've seen a lot of transitions in this company, and I must say that the remarkable transition of this building that I remember building back in 1984 is just awesome for me. So with that, I'll pass the microphone on to James Weiner, our CEO.
So again, we want to welcome everybody. We're very proud of what our team has accomplished here and delighted for the opportunity to share this with the governor, his team, and with all of you. I'm up here speaking on our behalf, but this is really Joe Fallon's vision. And Joe and Michael were kind enough to invite us to help with the execution. There's kind of a special thing that happens when two family-owned entrepreneurial companies with a shared set of values get together. In this case, we realized immediately that there was a great fit. We made an agreement to work together with a fist bump. Excuse me, it was an elbow bump. It was a COVID bump. With just the notion that we would each do our part and we would figure out the details later, and we sprung into this. From the time that we started conversing, or had that conversation, from the time we started with that, it was early September. We broke ground in this building, cut into the slab to start the preparation for the melt-blown, the Reifenhauser melt-blown equipment that you saw in there. That was mid to late September. And it was 3 months later before we were able to turn that machine on and submit high-quality masks for testing at NIOSH that they indicated quickly not just met but greatly exceeded their requirements. So 3 months to do all this is definitely lightning speed. We simply couldn't have done that without Joe's support and without support from an amazing team of people that we have in our company who have dedicated themselves day in, day out through this whole thing to making it happen. We're committed to the idea that with innovation and automation that we can produce high quality, cost-effective PPE in the United States. Our vision, based on the plans we have in place now, is that this facility will be one of the largest producers of N95 cup masks and gowns in the country, in North America for that matter. We expect to have 500 people employed here by the end of this year or first quarter of next year. Those are good paying manufacturing jobs with upward mobility attached to them. We believe that manufacturing itself is a vital part of our local and national economy. And while we have global operations, we tend to manufacture in the various regions we are for those regions. And with that experience and looking around at what we see globally, we really believe that this can be done. We're excited to be a part of it. Excuse me. So our vision here is to serve as many frontline healthcare workers, clinics, hospitals, businesses, institutions with these masks. The need is not just COVID-based. The need is going to continue afterwards if we just supply a small portion of what's currently being imported, that there'll be a robust industry for us and others here. The final thing I want to say is that this would not have happened without the foresight of the governor and this administration. that we were privileged to get a Merck grant to support some of this investment. But it was also the standing up of Merck itself, the call to manufacturers and entrepreneurs to participate. That was very inspiring to us. It allowed us to fulfill our purpose and our values and live those in a very big way. So we're honored to have been part of this process and do what we can to help at a very difficult time. So with that, I want to introduce the governor. Thank you for coming.
So this is the 1-year anniversary of the signing of the executive order here in Massachusetts that put the Commonwealth into a state of emergency, and I have to say, well, first of all, I wasn't expecting this. What I have to say is, when I think about what we went through in those first few months to try to find PPE in a world where every global supply chain had basically been frozen because of the pandemic, and the difficulties associated with getting very basic protective equipment to our healthcare workers, our first responders, our long-term care workers, and so many others in Massachusetts who were looking for it. This is really, in some respects, a very special moment and a happy anniversary in some ways for the Commonwealth of Massachusetts. And to Joe and to James and to the team and to all the folks who are working here to make this facility a reality, I just want to say God bless and thank you. And I remember talking to Joe Fallon about this, and he basically said, hey, I'm a developer. That's what I do. I build buildings. I don't know the first thing about how to actually create an N95 manufacturing facility, but I'll be goddamned if I'm going to live in the Commonwealth of Massachusetts, one of the great centers of research and medicine and development on planet Earth, and have us struggle ever again to have to deal with the issues associated with PPE and protecting our workers. I remember you saying that to me. And honestly, James, I'm really glad he found you guys because, as he said, he's a developer, and it would have been an interesting thing to see play out otherwise. But to have a chance today for the Lieutenant Governor and Secretary Sutters and myself to be able to walk through this facility and to get told the story about how these folks worked together, took advantage of one of our Merck grants, like so many other manufacturers here in Massachusetts, and created a facility that has the capacity to produce literally millions and millions of really high-quality PPE for not just people here in Massachusetts, but people all over the country, and doing it with a series of suppliers and sort of participants in this that, for the most part, are all domestic, which means, once again, if there were to be in the future, God forbid, the kind of just complete and utter shutdown that we saw at the beginning of the pandemic, we would still be able to continue to manufacture this gear here in Massachusetts and to continue to employ hundreds of terrific people like the folks who are here with us today, who would be supplying so many of those frontline workers with a really top quality, FDA approved, NIOSH approved product. And I think in some ways it's a real tribute to the ingenuity and the creativity and the drive of so many people here in Massachusetts that when we put that original grant proposal out there looking for manufacturers to pivot and support this initiative, so many signed up and went for it. And this in some ways is as good an example as you're going to find of that kind of creativity here in the Commonwealth. COVID is still very much with us. We have seen very positive trends on case counts and on hospitalizations and on our testing positivity rate, but it is still very much a fundamental fact of life, not just here in Massachusetts, but in many places around the country and around the world as well. Vaccines are also here, and they are in many respects the light at the end of the tunnel, but it's still really important for everybody to keep wearing masks and following all the safety guidelines to eliminate and stop and prevent the spread of COVID-19. Face coverings, and I don't need to say this in this place, but it's always important to point out that they are very effective at preventing the spread and are a critical part of how our residents are able to protect themselves and others, whether they're at school, at work, or out in the public. The masks that are being made here are an industry gold standard for maximum protection against airborne viruses, and we're just absolutely thrilled to have them being made here in Massachusetts with an incredibly bright future for this facility going forward. With respect to the data around vaccines and COVID cases, yesterday DPH reported 1,006 new cases on about 60,000 tests. The 7-day average of percent positivity is down to 1.74%. There are about 700 people currently hospitalized, and of those, about 185 are in the ICU. On vaccines, almost 1.5 million first doses have been administered in Massachusetts, along with 26,553 J&J doses, and over 2.2 million doses overall have been administered in Massachusetts. Yesterday, 85,000 total doses were administered, which marks the single biggest day of vaccine administration since we began this process in late December. Over 750,000 people in Massachusetts have been at this point fully vaccinated, meaning they've either received both doses of the Moderna and Pfizer vaccine or have gotten the Johnson & Johnson one-shot vaccine. And we continue to rank #1 among states for total doses administered per capita and first doses administered per capita among the states that have more than 5 million people, and we're #7 overall in total doses administered among all states. Today we have several announcements to make with respect to our vaccine distribution efforts in the Commonwealth, including the launching of a new pre-registration system that will launch on March 12th for the 7 state mass vaccination sites. That means this Friday, eligible residents can go online through mass.gov/COVID vaccine to register to receive notification when it's their turn to book an appointment at a mass vaccination site. In partnership with Google Cloud, our administration's created a process for eligible residents to fill out a form, get notified when there's availability for them to book, and then schedule their appointment to get their vaccination. Initially, this system is only for the 7 mass vaccination sites, but more sites will be added to the pre-registration system in April. The pre-registration system is designed to make it easier for residents to secure an available appointment and will soon replace the current process of large numbers of appointments being posted online on Thursday mornings for mass vac sites. But people should keep in mind that it will probably still take several weeks for eligible residents to be notified that there is an appointment available for them, because we're still receiving a real limited federal supply of vaccine doses to support our efforts here in Massachusetts. As I've said before, we probably have 2 or 3 times the capacity to dose people as we have available supply. For a little more detail, starting on Friday, eligible residents can pre-register to book an appointment online or by calling 211 if you're unable to use a computer. Residents will provide basic contact information and attest to their eligibility and choose their preferred means of contact, either by text, email, or phone for appointment updates. When an appointment becomes available for an eligible resident in their area, they'll be notified and they'll have 24 hours to accept the appointment. Residents will also receive a weekly update on their status and have the opportunity to opt out of pre-registration if they wish to do so at any time. Eligible residents can pre-register and still seek appointments at other locations. We should all remember there are 170 public vaccine sites statewide that post appointments regularly. There are also many healthcare providers, hospitals, and community health centers that are offering vaccines every day to their patient panels, and I'll come back to this topic in a moment. The pre-registration system at this point is only for the 7 mass vac sites and is another tool to help eligible residents schedule an appointment. We anticipate that we'll add more sites to the pre-registration system in April, but starting this Friday, pre-registration is only available for the state's 7 mass vaccination sites. Now, as everybody knows, the Command Center has been posting large numbers of appointments for mass vaccination sites on Thursday mornings. Tomorrow, Thursday, March 11th, will be the last time the mass vaccination appointments are posted online in this way. After tomorrow, all the mass vaccination site appointments will be booked through the pre-registration system. So you can try to secure a mass vaccination appointment tomorrow morning through the traditional VaxFinder at vaxfindermass.gov. But if you're not successful, you can plan to pre-register on Friday, and then you'll be notified on a first-come, first-served basis. Beyond mass vaccination sites, there are thousands of vaccination appointments available every week at different sites for the roughly 250,000 doses that we receive each week from the federal government. This week, mass vaccination sites, when I say this week, I'm talking next week. Mass vaccination sites will administer about 83,000 total doses, and that includes both first and second doses. And as I mentioned, there are about 170 public vaccine sites statewide, which include local boards of health, pharmacies, and regional collaboratives. The local boards of health and regional collaboratives will post somewhere around 63,000 doses next week and tend to post new appointments more regularly than once a week. Eligible residents can visit vaxfinder.mass.gov to find sites near you, including their hours of instruction for booking an appointment. There's also a large share of doses that are allocated to healthcare providers, hospitals, and community health centers every week. And next week, approximately 79,000 doses will be allocated to these providers. Those are first and second doses. And if you're a patient with a provider who's administering vaccines, you've likely been contacted by them with information on their booking process, and this is obviously another option for many residents as well. In addition to what the state receives every week, the federal government also provides vaccine directly to CVS health sites as part of the Federal Retail Pharmacy Partnership. This allocation's proven to fluctuate pretty dramatically from week to week, but we anticipate that next week about 95,000 doses will be allocated to CVS Health here in Massachusetts. Again, that's first and second doses. And in addition to those, there will be about 19,000 J&J doses that will be shipped to select community health centers in the Commonwealth to vaccinate harder to reach populations. Last week, the federal government informed all states not to expect any new J&J doses until the beginning of April. This is a bit of a change from that, but again, it's fairly small numbers, and we're looking forward to seeing the big numbers that J&J is committed to get delivered here in the Commonwealth at some point in the not-too-distant future. Currently, we outperform basically every other state in the nation with respect to our ability to administer vaccines quickly and equitably, but we can only move as fast as the federal government distributes these vaccines. We still get about the same 150,000 first doses of Pfizer and Moderna that we've been getting for the past month or so. To help us plan and to help provide the public with a better time frame and more options to book appointments, we would like to urge once again the federal government to do everything in its power to speed up and boost production and distribution. We understand and we agree that the process is frustrating for many people, and we'll continue to find ways to make the process easier from start to finish, even with limited supply. We are all working on this one together, and when it comes to getting our residents vaccinated as quickly as we possibly can, we know the process can't go fast enough. We're grateful for the patience and cooperation and, frankly, the enthusiasm to get vaccinated that we've seen from our residents so far, and we're very pleased that people have been stepping up and working the system as it exists, which has made Massachusetts, as I said before, #1 in the country on total doses administered and first doses administered on a per capita basis for all states with more than 5 million people. And with that, I want to turn it over to the Lieutenant Governor. Thank you.
Thank you. Thank you, Gov. And it's a real honor to be here with you, Joe Fallon, and your family team, as well as to James and your dad, Justin. I think he said 95. I don't think any one of us believe that. Thank you. Obviously, the Shawmut group and the Fallon group coming together, good things have happened, and we are very grateful for your leadership and your collaboration. I do want to give a big shout out to the men and women in the navy blue shirts for what you're doing every single day. Thank you. Thank you for your hard work. You're saving lives here and around the world. I also want to recognize my colleagues in government, Senator Timilty, Rep. Dubois, and Congressman Lynch's office. Thank you for your leadership as well. And as was said, I'm pleased that the MERT program, the Manufacturing Emergency Response Team, was an inspiration to your vision, and the relatively small grant of $2.7 million clearly inspired a major investment on your behalf to see this happen. We made $16.2 million in grants available to manufacturers to support pivots to make PPE, masks, gowns, gloves across our Commonwealth so that we as a Commonwealth are ready and resilient and can meet future needs as they come to us. So we are very grateful. Relative to educator vaccines, I'd like to make an announcement on our plans to provide designated days for K-12 educators, K-12 school staff, and child care workers to get vaccinated at mass vaccination locations. As you all know, last month we announced that these education workers would be eligible to book appointments in Massachusetts beginning Thursday, March 11th. This was to align Massachusetts with the Biden-Harris administration's directive for states to prioritize teacher vaccinations. To support this goal, our administration is announcing 4 days are being designated at the state's 7 mass vaccination sites where appointments will only be offered to K-12 educators, K-12 school staff, and child care workers. These dates are Saturday, March 27th, Saturday, April 3rd, Saturday, April 10th, and Sunday, April 11th. Educators looking to sign up at these 7 sites must use the pre-registration system to request an appointment and attest that they are indeed a K-12 educator, K-12 school staff member, or child care worker. A full list of examples of these workers is available at mass.gov/COVID vaccine. All other vaccine providers, including regional collaboratives, are encouraged but not required to restrict their appointments to K-12 educators, child care workers, and K-12 school staff on these days for consistency. If these 4 days are not feasible for a provider, they may designate alternative dates if necessary. Clinics may not restrict access to individuals who live or work in a particular area. The Command Center will post a full list of designated educator vaccination days for regional collaboratives next week. Starting March 11th, K-12 educators, K-12 school staff, and child care workers can book appointments through mass.gov/COVID vaccine and through the Federal Retail Pharmacy Program through retail pharmacies like CVS. This group of workers is eligible to get a vaccine at any of the Commonwealth's 170 public vaccine sites. Given the limited supply of vaccine, K-12 educators, child care workers, and K-12 school staff may not receive vaccine until maybe even mid-April or later, depending on supply. While we are designating 4 specific days to help vaccinate a good portion of the 400,000 workers in this group, they will otherwise join the pool of eligible residents who can get a vaccine. It is important that we continue to provide access to other eligible groups, like residents over 65 and individuals with 2 medical conditions. Our goal is to provide vaccine to all eligible residents, but we can only move as fast as the federal supply allows us to. We look forward to supply increasing in the coming weeks and months so we can vaccinate more of our residents. Thank you again. It's a real honor to be here with all of you. I'd now like to turn it over to Secretary Sudders.
Governor, Lieutenant Governor, and our friends from Fallon and Shawmut, I have to say, as I was walking through here, it was hard not to remember last March and April and our scrambling for PPE and the fact that we're standing here. There's a domestic supply chain, domestic manufacturing, and domestic getting it out the door. I often, to my staff, I say, thank you for your incredible efforts to get my favorite 4-letter, 3-letter word, PPE, out the door. As the governor indicated, the pre-registration system will go live this Friday. The process will hopefully ease some of the anxiety and the burden folks have been experiencing trying to secure an appointment because of the constrained supply of vaccine. I'm going to give a little bit more detail of how the process will work, although the governor did a pretty good job. The form will collect the basic information like name, address, as well as eligibility information such as occupation and whether the resident has certain medical conditions. The form will also collect email and phone number and ask for the preferred contact method, email, text message, or phone call. Once the resident has registered, their information will be added to the pre-registration list. Available appointments will be offered to groups of eligible pre-registered residents on a rolling basis. When appointments become available, the eligible residents on the pre-registration list will begin receiving notifications via the preferred contact method. If you selected email or text as your preferred contact method, you will receive a customized link that only you can use to view and book available appointments on the scheduling website for a mass vaccination location. And you have 24 hours to do it, so don't panic. If you selected a phone call as your preferred contact method, you will receive a call with information about the available appointment. You will have the option to ask for help booking over the phone when signing up on the pre-registration form. One day before you're offered an appointment, you will receive a notification allowing you to plan. And once you're prompted to book an available appointment, like I said, you will have 24 hours to book that appointment. To accommodate older residents and others who are unable to use the form, the pre-registration form allows family members, caregivers, or other trusted companions to fill it out on behalf. Residents who do not have internet access or someone to fill the form out for them can call 211 and our community services representatives will help them pre-register. And finally, as we all know, as we go our way and seek vaccinations, we have other tools available to us. Testing. Testing is an important public health tool in addition to contact tracing, complying with public health mitigation measures such as face coverings, physical distancing, staying home when sick, and good hygiene to mitigate the spread of COVID-19. Since the very beginning of the pandemic, the Commonwealth has been a leader in the nation on COVID-19 testing. To date, almost 17 million COVID tests have been conducted across all of our testing providers, and 1.8 million have been conducted at the Stop the Spread locations as of March 3rd. We currently operate Stop the Spread testing at 38 locations across 24 cities and towns. The price per test has dramatically decreased over time from originally it was about $136 a test to now it's about $67 a test. Yesterday, we announced an extension of the Stop the Spread COVID-19 initiative, which provides the free COVID-19 testing across the Commonwealth from March 31st, when we thought we might sunset it, now through June 30th of 2021. Residents of the state may visit mass.gov, get tested to find testing locations. Thank you. And with that, I'll turn it back to the governor.
Questions? Hundreds of thousands. I think the big issue is the continued shortage with respect to supply. The pressure that is put on everyone who's part of this because of the limits associated with supply and the desire for folks to get vaccinated and the capacity we have in Massachusetts to vaccinate far more people than we actually have supply to deliver is a real burden for people. And I think in that context, creating a pre-registration system that makes it possible for people to register and then know where they are in the queue and that they will be notified when they are eligible and an appointment is available for them to book takes some of the heat and some of the sting, I think, out of what the supply shortage does generally to people here in the Commonwealth. And that's not just true for the people who are trying to get vaccine appointments, it's for all the people who are trying to help them as well.
Can you assure us this new tool isn't going to crash on Friday? What tests have been done to make sure it can handle the traffic?
So our partner for this is Google. Google has set up pre-registration sites in a number of other states. They've pressure tested what we have experienced here in Massachusetts with what they've experienced in other states, and they're pretty confident that we won't have any issues.
So no prep, you're not doing prep mod anymore?
No, PrepMod is continuing to operate. Remember, this is pre-registration, okay? But PrepMod is going to continue to serve a number of the locally based and regionally based sites that operate in Massachusetts. You remember the pre-registration system is just for the 7 mass vac sites for now.
Can you just clarify, can anybody sign up for the pre-appointment? There's a little confusion underneath of that. Like, if I'm not eligible yet, can I sign up still so I'll be ready for when I am eligible?
I think at this point in time, we'd prefer people to sign up if you're eligible, but if people want to sign up otherwise, you know, sure. Which piece of it? Well, keep in mind that almost all the costs associated with delivering vaccines, the shots in the arms, is reimbursed by either insurance carriers or by FEMA. So the net cost to the Commonwealth of its operating its mass vac sites, for example, is incredibly small because the vast majority of the dollars that are associated with operating those sites are reimbursed based on the shots that people get by insurance. And the same is true for the sites that are operated by the provider community. It's one of the reasons we created a generous reimbursement rate for providers, because we wanted them to be enthusiastic participants in this process, and it's one of the reasons we did the same thing with respect to the community health centers. On the actual pre-registration system, yeah, we'll get back to you on that one. It's a pre-registration site, and the site itself is, the data on that site is owned by the Commonwealth. Correct. Correct.
You talked about the honor system before. We're hearing an awful lot of reports of people saying, yeah, I smoke and pregnant or whatever, I'm just going. How concerned are you about cutting the line, especially with young teachers? Is there any truth required?
Well, I think there have always been, from the beginning of this, isolated incidents of people who didn't, quote unquote, follow the rules, but the vast majority of people do. And I think in this particular case, with respect to attestation around educators, I mean, I'm expecting that the vast majority of the appointments that get booked for educators will be by educators, and I see no reason to expect that it wouldn't work that way.
Anything in the works, Governor, about trying to create a vaccine supply independent from the federal supply, sort of like we did with the masks with these types of?
You know, the biggest challenge with yeah, we did, I know. The biggest challenge with respect to trying to create a separate path for supply associated with the vaccine is the incredibly important and significant role that the federal government played in the production of all this in the first place. Moderna and I think Moderna and Pfizer were both, no, Moderna and J&J were both part of the upfront expense program from the feds in exchange for, you know, a certain number of doses, and Pfizer's deal with the feds was basically, we'll do our own research, but if we get approved, we need you to guarantee that you will buy a certain number straight out of the gate. So the feds, for all intents and purposes, are the single client, at least for the time being, of those three manufacturers. So we got to play by that set of rules. Well, it's going to be done basically based on when you sign up. I mean, it's going to be sort of the traditional first come, first serve, and you know you'll be notified that as an eligible person, because either of your age or your occupation, you'll be notified that you get a code, and that code can then be used to book an appointment at a site that's geographically close to you. And it literally, if you choose not to book within that 24-hour period, you just go back into the pool. But the idea here is to treat it as a first come, first serve type setup. Well, keep in mind that we have been vaccinating by age. We've been vaccinating by other things too. I mean, we chose to prioritize healthcare workers and long-term care workers and assisted living workers and personal care attendants and home health care workers and folks who work in congregate care with people with developmental disabilities, homeless shelters, and the like. But we did start with, 75 plus, and we're now working 65 plus two comorbidities, and this stuff is all consistent with the guidance that we received from the advisory board that we put together for this. Well, I can tell you this, that 9 out of 10 people who die in Massachusetts, who have died in Massachusetts of COVID, have been over the age of 60. All right. So the fact that we've significantly vaccinated big portions of the over 65 population and the people who work with them is incredibly important with respect to preserving life and protecting health. But there are. But part of the reason, well, one of the main reasons around the educator piece is we wanted to be consistent with federal policy on this and didn't want to create confusion for people. But there are a number of employer groups that come after this that represent employer groups that most people felt were sort of more at risk than others going forward. Go ahead. Well, go ahead, Mike. We can. Well, the biggest question mark that we can't answer, there are two big question marks we can't answer with respect to the state of emergency. One is, how real and how significant are some of the variants that are currently working their way around the world associated with COVID generally. We currently test through the Broad a lot of the positive test results that come in to determine what's going on with variants here, and we have picked up a number of those variants as part of that process. And because they're relatively new, what people do know about them is they are far more transmittable than some of the previous variants associated with COVID. But whether or not that is enough to create another surge is sort of an open question at this point. We've been incredibly pleased by the fact that we've been able to vaccinate so many of the people who are most at risk of being hospitalized or losing their life over COVID. So as long as those vaccines stand up against the variants, you know, the thing you worry about the most here, which is people who are vulnerable and at risk getting COVID and getting sick and possibly dying, I think, you know, we've done a pretty good job so far of focusing on those key communities. That's question number one. Question number two is, what is going to happen with supply? And, you know, we heard in December that we would have more supply than we had demand by February. And then we heard in January we would have more supply than we would have demand by March. And then we heard J&J and Pfizer and Moderna make commitments to Congress about where they were going to be in March. And we're basically being told that between now and the end of March, we shouldn't expect any additional supply. And we will in April have more supply than we have demand. If we ever get to that point, and I really hope we do, the ability for us to move really quickly to vaccinate huge portions of the remaining population in Massachusetts is extremely high, given the amount of capacity that we have available. And for me, this whole thing is kind of the race against time with respect to whether or not there would be the potential of a third surge. But what I would say to you, that's a really long answer for, I don't know exactly what's going to happen with the variants and what they mean with respect to transmission or vulnerable populations. And the second thing is, I don't know how fast, until I know more about the supply question, we can vaccinate. You know, we've done 2.2 million, 2.2 million doses at this point. About 700,000 people are fully vaccinated. You know, if we really did get more supply, if we got enough supply to meet the demand we have and the capacity we have, I mean, we could do more than 1 million people a month. Easy. We could probably do 2 million people a month. And that will move the ball in a big way to get us to the point where I'd start feeling comfortable that, you know, we can start thinking about where we are with respect to the emergency order. But there's still some unknowns out there that got to get worked through. Do you have a...
Secretary Sutter, I have two questions for you. The first, we're receiving reports from some local boards of health who did first doses before they were cut off from receiving supply, not receiving the second doses in time for the clinics that they had scheduled. What is happening there, and why the delay?
There shouldn't be any delay, so any municipality that had requested second doses that we know of, the requests went in and they should be getting their supply this week.
So if they, for some reason, aren't receiving them in time, they just need to reach out to you?
There's like every day there's a constant back and forth between providers and the Department of Public Health and my staff on allocations. And so I would say if there is a municipality that was expecting second doses, got their confirmation. So when we put the order in, the provider gets a confirmation back from us. The order's in, nope, you're not getting any. So there is a back and forth. It doesn't go into just a black hole. So there's a confirmation process. And then they're notified when they get the delivery date. So they actually get the date from FedEx when it's delivered. So I would say if there's a municipality who believes that they have an order that they're waiting for, they should contact the Department of Public Health. And there's actually, I don't have the email address, but there's actually an email address that you serve to them. No, our commitment has always been, if you get a first dose, we need to make sure you get your second dose. There were a few times when some providers did not put their information in, so it's hard to know how to order second doses if you didn't know that some of the first doses happened. But we've been very committed to second doses.
Meeting today, I think we'll say with you, somebody in your office about firefighters and the teachers union and trying to get doses to teachers and educators in their communities.
Commissioner Riley and I are meeting with the Mass Teachers Association tomorrow, not today.
Professional Firefighters Association, as you're part of that. Any thought to, I know you're designating days at the mass sites, but would you consider giving any doses to these local communities if they have a plan?
We don't have more doses to give. So we have been informed by the federal government as of last night that we're not getting additional new supply in until the end of March. No J&J, no Pfizer, no Moderna. The only new additional doses we're getting are 5 trays of Pfizer for second doses, over and above what we currently get. That's what we get.
Seeing clinics at school buildings is just not possible.
Expanding when you don't have expanded supply. We have a constraint of supply in the Commonwealth of Massachusetts. But Commissioner Riley and I have been meeting with the Math Teachers Association for the past few weeks, and we look forward to the meeting tomorrow.
Last question.
So again, they're a few weeks out, right? So we get week to week. But at this point, I would assume it'd be about 25,000 appointments would be available exclusively for educators at the 7 mass vac sites. And if we have, additional supply within what we have, we obviously will increase that. But right now, I'd say it's about 25,000 appointments for those 4 days. Total.
Real quickly on the second doses, we've had some calls from doctors' offices saying they've also had trouble getting their second doses. Should that be happening?
So again, if people respond to the survey, which is, nothing has changed in this process, every Tuesday we request of the hundreds and hundreds of providers, what is it they need for the next week? And then we go through all of those. There's a lot of back and forth to confirm, first and foremost, how many second doses do they need. We also have thresholds. So if you have supply on hand, we expect you to first work through the supply you have on hand before requesting additional doses. So it's really been the same process we've had since the beginning around requesting, we evaluate it, we determine whether you have supply on hand, and if you have supply, right? We don't want idle doses. We want people to use the doses, and then to request what they need. And in some cases, for some providers, it's been closing out their small clinic programs. Mm-hmm. You should go where you have. So first of all, as the governor, as we've always said, whatever vaccine is offered to you, you should take. I mean, that's like first and foremost. But to answer your question specifically, it goes to these 2 questions. First and foremost, we want to ensure if you've had your first dose of Pfizer, Moderna, that we make sure your provider has the second doses so that you are fully vaccinated. So at the very top of the list, if you would, are second doses. And then we have the mass vaccination sites, we have the regional collaboratives, we have the hospital systems, open providers. I'm not doing this in like order. I just forgot something. Community health, thank you. I knew I forgot. Community health centers, and we're closing out the congregate care program and the like. But we always start first with what do we need to ensure if you had the first dose, you're getting the second dose. And then after that, it is what we have for supply and who can accept Pfizer, who can accept Moderna, and did we get a little bonus supply of J&J, which everybody would like to have.
Thanks, everybody.
Can I say one thing about this? Part of the reason we pick dates that are later in the month of March and early April is, once again, we are going to hope that the enthusiastic projections of some of the folks in D.C. actually come true. That we are going to get, finally, some of the J&J tsunami of vaccines that they committed to when they signed up under the federal program in the first place. I mean, the beauty of that is it's a one shot, which makes a huge difference with respect to all the issues that the Secretary was just talking about with respect to the, not only do you take up a second appointment for that second shot, it's also a bit of a logistical challenge. And in fairness to these guys, all right, I get a lot of the same phone calls you get, from state legislators, local officials, so does the lieutenant governor. And in almost every one of those cases, when I process it back, it's because there's been some miscommunication with respect to how many doses people have used, how many they have left, and what we expect from them with regard to the level of dosing they're supposed to do. Remember, we put some very stringent guidelines in place about 6 weeks ago that said, if you're not using your doses, we're not going to give you any more, right? Because we were concerned about the amount of vaccine, as were many of you and a lot of people in Massachusetts, that too many doses in Massachusetts were sitting in freezers and not getting into people's arms. The other advantage of the J&J vaccine is it doesn't require the deep freeze, it doesn't require the thaw, you don't have to do all the prep work that you have to do with the other two, which means you can treat it. You don't have to be as sophisticated an operator to actually use it effectively. And you can also think about how to bring it in as a mobile tool. You know, a lot of people have said, why don't you do more with mobile? Well, part of the answer with that is it's hard to do mobile if you have a vaccine that's as complicated to store, prepare, and all the rest as the Moderna and Pfizer vaccine are. If you get to the J&J vaccine, you know, whether someone uses every single dose or not, they don't have to think about how many they have to thaw the night before, and it's one dose. So if you decide you want to go do a senior housing site, right, and just hit as many of those people as you possibly can who want to get vaccinated, the best part about it is it's one dose and they're done. We don't have to write down all the information and everything you could possibly think of and then figure out how we're going to get back there again in 3 weeks and make sure all the same people are there to get their next dose. So part of the reason for the late dates on some of the regional collaborative educator days and the Mass Vac Site educator days is I'm hoping that this time maybe the time frames associated with when the big dose of supply is going to land will land consistent with that, and we'll then be in a position to do tons more dosing over that very short period of time. But part of what we struggle with every single day is way more capacity and way more ability to vaccinate and way more people who want to get vaccinated than we actually have supply. And I would urge everyone, if you're looking for somebody to reach out to on this, start asking the folks in D.C. why Moderna and Pfizer have not delivered on the level of participation that they said less than 10 days ago in front of Congress that they were going to deliver on in the month of March, and why J&J has missed all of their deadlines with respect to what they said they were going to deliver in the month of March. It creates real complexity for every state in the country, every healthcare provider, and every person who's looking to get vaccinated. Yep.
Today, I wanted to speak to the importance of that to national government here and how critical that is to the state vaccine distribution, testing, and all that.
Well, I mean, there's a lot of pieces and parts to that. What I would say is the thing I'm most grateful for is that they got it done in time for a relatively smooth transition for folks who are out of work. The last couple times they did this, to extend unemployment benefits for people who are out of work, they did it so late in the process and it came with so many new rules that it created really big administrative challenges, not just here in Massachusetts but across the country, in trying to actually figure out how to comply with the new program, collect whatever new data you needed to collect from beneficiaries, and then figure out a way to continue to support them. The fact that they got it done now, when the benefits end at the end of March, means we actually have 2 or 3 weeks here to tee up the unemployment benefit extension. And remember, that is in many respects the single biggest piece of financial support every state's gotten since this whole thing began. I mean, we got almost $21 billion in unemployment funds from the feds since the start of this. It was 15 years worth of unemployment payments. That, you know, if you think of what we typically put out every year, there's 15 years worth of unemployment payments in 10 months. So that's a big deal for a lot of people who are in a pretty crummy place with respect to COVID generally. I think the second thing I would speak to is the amount of support for education, which should make it possible for every school district and every municipality to find a way to do whatever they think they need to do as we go forward to either support summer schools or acceleration academies or additional work around building construct and all the rest to support that stuff going forward. And I think the third piece is the support for the vax and the testing activities, which will also make a big difference as well. But it's getting it done on a timely basis so this unemployment thing does not become the nightmare it's been for a lot of people. Each time the extension gets put in place is a really big deal.
Thanks, everybody.
I don't know the answer to that. Is there a specific time the website goes live on Friday morning?
Later Friday morning.
How about mid-morning? Okay. Thanks, everybody.
Governor, you happy the House and Senate teams are agreeing to give PPP relief to small businesses? I think you filed a bill.
We did.
Is that something you're looking to sign?
Yes. We'll see. Have we seen it? Yeah, I don't think we've seen it yet. I would like to read it. It's usually important, but the PPP piece is important. So is keep in mind that the unemployment piece is also important. What we basically did there was created we have to pay the federal government back for a big piece of the unemployment money we spent that wasn't quote unquote theirs, okay? And the way we typically pay back a deficit in the unemployment fund is through charges on employers. And by passing this legislation, we will have the ability to use a much less expensive financing mechanism to borrow money and pay back the fund. And that will save employers literally huge amounts of money, which will help them, perform in what everybody would agree is a really difficult period economically for many of them. And that part in particular, it's kind of wonky and nerdy and it doesn't get a lot of attention, but the difference in terms of what the borrowing costs and the payback will look like is far better under the proposal we made, and I believe the legislature is going to enact, for all employers in Massachusetts. When you're trying to create a recovery, makes a big difference. It doesn't become quite the same draw against people's ability to hire and support their employees. Yeah. I'm not familiar with the bills. What I would say is that Lieutenant Governor and I and Secretary Sudders have been talking to the legislature about this stuff since the very beginning, and I'm pleased to say that a number of the things we did under emergency orders are now state law, which is great, because some of them are things that will, telehealth, just for one example, are things that should survive the emergency order generally, but I think we've been talking to these folks about this stuff on a pretty regular basis, and if people have thoughts and ideas, look, if we don't all learn a bunch of lessons coming out of this about what the right way to operate and prepare for one of these in the future is, beyond the work that was done by you all and by Joe Fallon, and that's being done by the folks, as the Lieutenant Governor said, in the blue shirts, we will have missed a big opportunity. Because no one ever expected to be using emergency orders for pandemics that were going to last a year, that's for sure. And thank you all very much for what you do. God bless.
Thank you so much.
Thanks so much. Good to see you, man.